Happy New Year, good morning, and thanks for joining us on the Monday edition of TVC Breakfast, the very first show in the new year. Now, countries around the world are witnessing a huge spike in the daily toll of COVID-19 cases, and this is due to the Omicron variant. Since Nigeria first discovered its first case of the Omicron variant in December, the country has seen a steady increase in new cases as well. Nigeria is witnessing the fourth wave of the pandemic, and Lagos remains the epicenter of the disease in the nation, accounting for most of the daily recorded infections. States in the country are already reopening isolation centers in readiness of possible admission of COVID-19 patients as cases of the virus continue to rise in the country. Well, joining me in the studio is Pascal Achunine. He's the Executive Director at Health Emergency Initiative. Good morning. Happy New Year.
Same to you. Happy New Year. Happy New Year, viewers.
All right. Let's look at the issue of COVID-19. In recent days, we have seen an increased rise in a number of cases, which some persons would say, yes, is expected because of the celebrations, the Christmas, the New Year, people mingling with, going to see family and all of it. But then, beyond that, what are your concerns? Especially how we have been able to manage the rising cases over time. Remember, we still have the Delta variant very much with us, and now we have the Omicron.
Yes, we need to put this in perspective where we're coming from. And right. We've had about 3 different variants. We had, even before Delta, we had Beta, we have Alpha. Yeah. And most of them were more deadly, especially Delta, vis-a-vis Omicron. But we can see that this seems not to be abating globally. And restrictions on international travel, people from Nigeria still travel, and vice versa, people come into Nigeria, especially Nigerians who stay abroad. A lot of them visited. And what we are looking at is what measures have been taken in the unlikely event. I'm being very positive that this surge is witnessed. We've already seen some element of it that led to be the fourth declaration of the fourth wave. Yes. Before, we were assuming it was not going to come here, but we can see that the number has increased. 2 Saturdays ago, about 26 people died one single day from COVID in Nigeria. So and if you look at the number, we're about 2005, 2006 for a long time. Now it's over 3,000, and that's of the official figure. So what we will be looking at is what has the regulators' leadership at the federal and state level done to ensure that in the event that the numbers we are seeing in Europe, we see anything close to that, God forbid, here, that this is the emergency measure we are taking. And because right now, as we speak, we still do not have a cure for COVID, is the vaccine. Is my vaccine. And the vaccine has moved, you take the first, you take the second, and there's even the booster. Some haven't even taken more than one booster. So it boils down to the non-pharmacology solutions and measures, which includes maintain social distance, avoid crowded places, wear your nose mask, it's trash. I mean, so it may shock you that people feel that nose mask was, for those who ever did, it was for 2020 and that period. But here, 70 to 90% of the population don't care about nose masks, even among those who are educated and those who should know. And then, of course, wash your hands regularly. Because the advanced world does not yet have a solution to this. As we speak, Netherlands is on complete lockdown, Holland, as we speak. So more restrictions are applied across different parts of the world. And we don't want to get to a situation where we get to such a stage, and they have systems. Those people, their systems are functional. Ours are very weak.
Very weak systems. Now, let's look at, you mentioned something that I want you to perhaps expatiate on. You said the various levels of leadership, how are they addressing these matters? Let's take Lagos, for instance. We see the kind of effort Lagos State is making, at trying to, yes, reopen some of the isolation centers that were closed, just putting measures in place to ensure that because of the inflow of people into the state and all of it. But that doesn't seem to be obtained across the 36 states of the Federation. We still have interstate travels. Are we really handling this, the kind of leadership needed to drive every, effort being put in place to achieve the result we need? Are we having that cohesion? Because it seems if we are not having that cohesion, then the effort we are putting in might not yield any result.
Okay, there are some indicators that would make the citizens. First of all, you saw that about 1 million plus vaccines were wasted.
Right.
So how could that happen in the first place? Were the citizens effectively mobilized? As we speak, we have less than 5% of the population vaccinated.
Yeah, about 4%.
Other countries are talking about 60% or more. So the measures put in place so far in citizens' engagement is weak, because it still comes back to trust deficit. People don't trust our political leaders. In a country where WHO published a report recently, and that report says 627,000 people died of malaria in 2020, and out of that, 27% came from Nigeria, and most of them, if you check, are infants. As we speak, between then and now, you can hardly see anything that suggests that these are steps we are taking to mitigate that from happening again. So people don't trust you, the system. Again, your actions can speak better than what you say. So some of the, if you go to UK currently, they were setting up emergency beds and wards within the hospital premises in the event that the surge cannot, the capacity of the existing facility cannot accommodate the surge. So they have proactively put measures in place to minimize deaths, to minimize the crisis that will occur. So here, if among the 36 states, only few of them are paying attention to this in the first place. At the federal level, we still conduct programs and activities that does not reflect strict enforcement with the protocols. So whether it is political related program, whether it's social related program, you still see that very many times people do not, those who should lead by example, do not demonstrate, show it. Again, we also have weak enforcement system, because government also has this uncommon capacity to not only make laws but also enforce
the law.
So there are ways and manners that you can legitimately enforce, but that is lacking. So you see many people have traveled to the village for Christmas, for the holidays. Many people came, the diaspora community are here, so they have mingled, and in the coming weeks we'll see a lot more of that. Even Harmattan, as Harmattan was come, because it's also a trigger. So we should anticipate that this is the way we can test more, this is the way we can also regulate more. But enforcement is weak. We are not planning, and we don't plan on any data. So we just do, okay, this is what is happening in the UK or other parts of the world. We copy a number of them. Are those things connected with local realities? No. So we lack political will. We are not deploying enough resources to this. We are paying lip service to issues of health and the lives of Nigerians. And we are not leading by example.
You talked about testing. What's the situation of things as we speak? Are we still doing enough with regards to that?
We have never even scratched it. A population that has of 200 million plus, that has not yet tested up to 5 million in about 24 months. That does not show that we are actually paying attention to this. So if you go to, I recall that at a time, some of the isolation centers were dismantled.
Yes. And
then the rapid tests, the ones that people could easily access, there is not enough effort and resources deployed to. And one, for Nigerians are contending with a lot of things. So somebody that buys a 12 6.5 kg of gas at 9,000 naira, or resort to firewood and all that, daily struggling. So when you tell the person that these are the things you need to do to stay alive, most of them feel that they're already dying. They're content with insecurity and so many other things. Hunger,
they'll tell you something must kill a man.
Yes, something must kill a man. But we still can, because when you have breath, you can still make it. That's what I want to assure. First,
when there's life,
when
there's hope.
Life, yes, there's hope. So the government must roll its sleeves. 2 years ago and between then and now has shown that health is wealth, but we don't in any way express it with any seriousness in Nigeria. So I want to put it in 2 ways. Nigerians, so you're not living for the government, you're living, you also have your
You should take responsibility for your health.
Life. So those non-pharmaceutical measures, let's take it serious. If you go to Europe, they've shut down clubs and most social gatherings. They cancelled it for the new year. Here,
even if you have to go, you have to present
evidence that you've been vaccinated, and that you have a negative test result. So we are not, if you check whether the places we conducted service in the course of the holiday or social gatherings, nothing suggested that any of those things were in place. So we need to go back to the drawing board and recalibrate. And it's never too late. We don't have emergency, we don't have the surge yet as much as what is happening in other parts of the world. So these are our best time. The best time was yesterday. This is the next best time.
But we've seen a surge in the number of persons who have had malaria, cough, cold, and all of it. And people are saying perhaps that is Omicron, so to speak, which is said to be milder as a variant.
There is a school of thought that Omicron is less virulent. It's not as deadly, as horrible as the Delta. So it is possible that I've come across persons, very close associates. Oh, I had COVID, but there was no movement to any isolation center, and eventually, after 5 days, the person tested positive. 7 days, they tested positive. So that is likely to have been happening because of this variant. But it is also good that the potential economic losses and social disruption, we can minimize it as we take these non-pharmaceutical measures. So we are looking forward that somebody is listening and somebody will say, okay, let's take this more serious. Health, for Health Emergency Initiative, for instance, we realize in one of the locations we are supporting that the death of children reduced by so number just because a little measure we took in supporting child and maternal health. So in Nigeria, we just need to do a little, and we see a lot of positive outcome from the government. And I also want all the private sector not to be distant from this. We are all stakeholders.
Absolutely, we are all stakeholders in this fight, and that's where we leave the conversation. Pascal Achunine, Executive Director at Health Emergency Initiative. Thank you for your time.
Thank you for having me.